Hello, everyone, and thank you so much for joining me today. Today, I would like to talk about your project assignment related to the epidemiology research paper, where depending on the quality of our research paper, we will also be able to publish that. If not, you still need to write this article as well, and this is part of the assignment. This is for replacing, I would say, the format of an essay question, because in an essay question, we have a very similar sections in the essay question, but here we're looking into, of course, advancing your experience in writing articles. So what is that exactly? Here, you have been given the instructions, of course, on the Blackboard website. The title of the research project is Healthcare Research Epidemiology Research Paper Guidelines. And here, what you will need to do is to write a paper with the following sections. I will go over the topics that you may choose from, okay? So first of all, think about the fact that you're going to write an essay, but this essay is going to have a template which is similar to a research paper that may again be published depending on its quality. So what I gave you here was a template. So I was asking you to have these sections in your paper. So you're going to have a section which is the introduction. You're going to write briefly, maybe in 2 or 3 sentences, describe the health issue or disease in the Canadian context related to your topic. Then you are going to write about the geographic focus. This is just to say that the research that you're doing is maybe related to a city, maybe to a province, maybe to a country, and here to the country itself. So it's again 2 or 3 sentences just to explain the geographic focus. Then you are going to talk about the significance, so explain why the issue is important to public health. So overall, the introduction that you're going to make is going to be about 2 paragraphs. Here I just gave you much more details about what topics, what I would say, what sentences must be written in those 2 paragraphs. But overall, this is just an introduction to your work. Then you will need to talk about the background of the disease, because you're looking into a disease or I would say a disease condition in a city, in an area, in a country, or even I would say in a province, for example. So here you're going to talk about the background of that disease or disease condition. And here you're going to write again 2 or 3 paragraphs. And inside here, you can, for example, talk about the overview of the disease, signs and symptoms that we find, the diagnosis, screening methods, incidence and prevalence, for example. So overall, again, you need to write 1 or 2 paragraphs for the background of the disease in your article. And here I'm giving you, again, I will say some details on what topics you can also make sure that exist in your 2 paragraphs. Then you are going to talk about surveillance methods. These are methods that we have been using in order to do the surveillance for those disease conditions. So now again, is it in Canada? Is it in, again, in the province? Is it in a city? You're going to write 1 or 2 paragraphs about the surveillance methods as well. Now, with the same idea, we are continuing to look into now the epidemiology analysis. So here, you're going to write the descriptive epidemiology. You may find, I would say, a few articles with maybe a few pictures or a few, I would say, diagrams or tables that you can use. And here, for the analysis, you will just need to put again 2 or 3 paragraphs and to explain an existing table related to the disease or the disease condition that you chose in order to write your article. Then you will have to look into the prevention strategies and some recommendations for that disease, I would say, or that, I would say, disease condition. So here again, you can write for 2 or 3 paragraphs maximum, and you're going to talk about what has been done. And please make sure that you put future recommendations. What happens is that in the healthcare sector, we don't wait to be in front of an epidemic, for example, and then to think about, okay, what we should be doing. No, we always look into the previous cases. We always look into the history of events, and then we are going to write protocols in order to, again, as you understand, do the surveillance methods, doing the analysis, and of course, going over the prevention. And we continue to recommend for the next cases that may occur. This is why we need to do research. We need to explain different types of epidemiological issues that we have. And then we need always to talk about the surveillance, about the methodologies, about the preventions for that specific disease or disease condition, and then to write about the preventions and to give recommendations for the future. So what hospitals and even, again, the public health organizations all over the world, they do is that they are going to study, and that's why they do epidemiological studies. And then they are going to write protocols in order to prevent, to be ready to prevent and to help the population beforehand. This is why, for example, when you go to any hospital, you're going to have different protocols for different outbreaks, because some outbreaks are because of maybe the air conditioning, and there is maybe a microbe that is going to spread all over the hospital through the air conditioning, for example. Or it may be another spread or another outbreak, not through the air conditions, but through, for example, touching the surfaces, or maybe because of a food which is, again, not safe. So we may have different outbreaks, but since we may have had already a similar outbreak in the past, we need to document what was the case, what has been done, what were the tools that have been used, and then what are the recommendations, again, for the next time that we may be facing a similar epidemiological threat. So at the end, of course, of your article, you're going to write a conclusion. This is the summary of your findings that you already stated in the previous sections. And then you're going to add a reference list. And these citations must be, of course, minimum 5 studies, publications, and it must be all written in the APA format. Now, I also talk about the fact that you can also use artificial intelligence, but don't forget that you have limitations and ethical considerations for this as well. You can easily use artificial intelligence, of course, for doing your research. You can, of course, also find articles, but you need to go over those articles, and then you are going to now write yourself those paragraphs. You're not going to use the AI tool in order to write for you, because AI tool may repeat itself, may add some irrelevant information from all over places. It may also even refer to some websites where the content has not been proofread, or it's not, I would say, the content is not well established or is not checked and verified. This is why you can always use AI. And again, I recommend that to use AI. It's like using Google or any other search engine. But here, AI is allowing us to, I would say, do faster search. It also allows us to give some ideas, some brainstorming ideas, of course. And it will also allow us to, for example, change the format of our references, because you have references from URLs, and then you give it to the an AI generative tool, and then it can change that list into a list of references in APA format. So the aim is that you learn more of course, doing research. You also need to use existing tools such as the library. You have access to your college library as well. You also have access to databases. You also have access to free references as well. But in addition, you can also look into the search on internet, and you can also, I would say, accelerate your search using artificial intelligence, I would say, generative tools as well. But again, pay attention to the limitations and pay attention to the ethical considerations. Now we are going to look into the topics that are proposed for you. The topics that are here are, again, for your topics. Okay, you can, for example, I mean, what you will need to choose is one of the topics among these. So what are that exactly? The first topic that you can choose is called improving vaccination rates in rural Canadian communities. So here you're going to start writing your introduction. You're going to write a paragraph that is going to have this content here. So I'm just from here to here. And then you're going to up to here, and then you're going to write again 2 paragraphs. Make sure that you put in-text citation and that you also put your references at the end of your article. Then you're going to write about the background of the disease. So here you're going to write a description of vaccines and their public health benefits. You're going to discuss in your background of disease, discuss the potential risk associated with low vaccination rates. You're also going to present current statistics on vaccination rates. It may be, again, a table from a valid source, or it may be just a graph, for example. So what I did here is that I gave you the template for writing your research article. I also gave you several topics, and I gave you also the information that you will need to consider in order to write the content of each section. So I repeat again, when you are going to choose the first article or the first topic, improving vaccination rates, you are going to write an introduction. And you're going to write about anything, even more, but this is the minimum that you're going to write about in 1 or 2 paragraphs. So the same thing applies to the second section in your article, where I gave you exactly the topics, the relevant topics related to this research topic that you have to add into your background of the disease section. So the same thing applies to surveillance methods. For your research topic, you can do some search, and then you're going to write 1 or 2 paragraphs where you're going to make sure that you're writing about a review of existing methods for tracking vaccination coverage in Canada, or to discuss legal requirements related to vaccination data reporting in Canada. So by giving you this, I would say, these in-depth topics, I'm just helping you to write your article. I'm not telling you that you need to do exactly what I am giving you. You can go beyond these points, but for your assignment, the minimum requirement is, of course, here. It means that you're going to, for example, again, for in your article, talking about the section for epidemiological analysis, you are going to write about these 3 points. So I am helping you or giving you more details related to how you're going to proceed with writing the content related to that topic. Now you're going to continue prevention strategy and recommendations. You're going to talk about the existing strategies, future recommendations, and of course the conclusion, and you're going to write a reference list. So in a nutshell, what you saw here was just, again, a list of the topics or the points that you will have to develop. Each of the sections for this title of your article, the first article, each section needs 1 or 2 paragraphs with in-text citation. So you're going to go write, I would say, do research, of course, but you're going to write maximum, I would say, 10 to 12 paragraphs, including, of course, the conclusion, and in addition to the reference list that you're going to write. So the amount of, say, the number of pages, of course, it can be 10, 20 if you would like to, but as long as you are covering these, again, topics in your sections, you can make sure that you are writing an article that is publishable. Of course, if not publishable, it's okay. We are doing the exercise. We are learning how to write a research article, and here we are doing a literature search. So it's much more a review of literature that we are doing in this assignment. Now, if you would like to, for example, choose another topic, you can go and choose topic number 2, reducing hospital-acquired infections in Canadian long-term care facilities. So for writing this article, it's the second one, if you want to choose this article, you will need to write again these sections: introduction, background, surveillance, epidemiological analysis, preventions, and conclusions. And here again, in each of those sections, you are going to need to write 1 or 2 paragraphs taking into account these points. And again, these points, I already wrote them for you, that are related to the title of your research. So this is a template that I'm giving you. And the template has already all of the topics, minimum of a set of topics that you can add into each section. So you just start writing the introduction, 2 paragraphs about this. Then you write about the background of the disease, 2 paragraphs, surveillance methods, 1 or 2 paragraphs, then epidemiological analysis, 1 or 2 paragraphs, and of course a picture or a diagram or a graph or again a table from a valid source. Then you're going to talk about the prevention strategies, again, 1 or 2 paragraphs, and the conclusions. And it will end up with a reference list in APA format. Now, you can choose a third article. The title is Promoting Mental Health Awareness in Canadian Schools. Again, same thing applies for each and every of these titles. You are given all of the information that you can search on using, again, the library of the college, and obviously using any available online tool. And obviously you can also use, again, AI for brainstorming, for reviewing the structure of your writing, for giving you some new ideas, for allowing you to find, I would say, different sources of information. So use AI again. You still learn how to use AI, but again, don't forget that it has limitations for ethics and, of course, for the content. So it cannot write for you your article. You write the article on your own. You use AI, like search engines, as, I would say, assistance for doing some search. Now, another topic that you can choose is preventing childhood obesity in low-income Canadian families. Same here. You can easily, again, start writing your article. You're going to have several sections. These are the sections for your article. And you are going to make sure that you're going to write 1 or 2 paragraphs related to the points that are already added here related to this specific topic. Now, you can continue, of course, with different sections. If you want to choose this title, Enhancing Early Detection of Chronic Diseases in Underserved Canadian Populations, please start writing your, doing your search, doing your research as well, and then look into, again, references that will allow you to develop these contents into 1 or 2 paragraphs in each section of your article. So again, your article is going to have 1, 2, 3, 4, 5, 6 sections, each of them having 1 or 2 or 3 paragraphs, and then you will have also a list of references. Now, the same applies, of course, to any other topic. If you would like to have a new topic, just please let me know. And of course, I'm going to make sure that this has not been done by someone else, because we are looking into eventually publishing your work as well. So please look into these 5 topics that I already gave you. You can also work in groups, in teams. This is okay. You can do that as well. Just let me know who will be in your team and which topic you are going to choose. You can also do the job alone, no problem at all. Just make sure that you're going to follow the template, and you're going to make sure that you're going to take into account all of the elements of the answers or the points that must be developed in each section of the article. Okay, so you also have, of course, the assignment in epidemiology, which is already written here. I also gave you the template for the article. So for this, you can just save this template for writing the article. So once you save it on your desktop, you can now open it. And when you open, you can just start again. Of course, you're going to remove this section after having finished, and you're going to write your article using this template. So you see the indentations, you see also the font, the format as well. You can also see how you're going to write different subsections in this section of your article as well. You continue with the background of the disease, with surveillance methods, epidemiology analysis, prevention strategies, conclusions, and you're going to add your reference list. Of course, if you would like to collaborate, you can, again, if you would like to work with, not alone, but with a few students, you can always look into these collaboration guidelines for team members. And I also gave you the progress tracking. So you can also, if you want, you can also, again, have this type of document with your friends, with your group members, so that everyone knows who is doing what and when it's going to be done. So this is just for a matter of managing, again, your project if you're having several people and if you need to have this. If not, just use this template. Of course, complete the template, write here the title of your paper, of course, followed by your name, of course, and the team members, and then continue to do the search related to your research topic and write the few paragraphs that I ask you to write for each of the sections in your research paper template for epidemiology course. So I hope that it was clear enough. Of course, if not, if you still have any questions, please let me know or join me on the online classes, and I will be able to explain further. So thank you so much for your attendance.